Welcome to sensory. So we're going to be talking about sensory today. And so our first picture shows us the 3 P's of blindness due to open angle glaucoma. Before we get into glaucoma, I just want to mention some things about your sensory assessment and particularly your ocular assessment. So assessment of visual acuity with the use of the Snellen chart, and they do have a Snellen chart for the pediatric patients that don't know their alphabets yet. They're actually shapes like sailboats and cats and other things that the children will be familiar with. So the client will stand 20 feet from the chart and is asked to read the smallest line. Corrective lenses for distance should be worn during this test. So what the test is looking for is myopia, hyperopia, presbyopia, and so we'll get into that in a little bit with some of the future slides. So what we have when we talk about glaucoma is a group of ocular conditions characterized by optic nerve damage, which may be caused by increased intraocular pressure, also known as IOP. So the manifestations of the acute close angle ocular emergency, well, this results from an obstruction to the outflow of the aqueous humor, resulting in an increased intraocular pressure. So it's rapidly progressive visual impairment, severe pain in and around the eye, blurred vision with dilated pupils, nausea, and vomiting. So open angle glaucoma is insidious in its onset with slowly decreasing visual acuity. It's usually bilateral, but one eye may be more affected than the other. Halos around lights and the loss of peripheral vision are the late manifestations. Fluctuating intraocular pressures may also be a manifestation of open angle glaucoma. And the patient may not have any symptoms at all. So for collaborative care for this condition, we will look at our nursing interventions. The nurse will administer medications consistently on time. Avoid anticholinergic medications. Medications to promote pupils to contract are cholinergics, also known as miotics. And then there's adrenergic agonists, and then beta blockers, carbonic anhydrase inhibitors, prostaglandin analogs, alpha adrenergic agonists. So the therapeutic measures that you should take or that should be taken for this patient are possibly laser trabeculoplasty, iridotomy, drainage of implants or shunts, and the client should be educated on how to appropriately administer the medications. They should discuss the importance of avoiding activities that may increase the intraocular pressure, and they should follow up they should really follow up with their appointments. That is very important. Just to clarify a couple of the terminology that was used, when we talk about the laser surgery, and so that is the laser trabeculoplasty or trabeculoplasty. So that is a selective laser surgery that is used to lower the intraocular pressure in glaucoma. It's used when eye drop medications are not enough to lower the eye pressure in your patient. And then when we talk about the iridectomy, so that is an eye surgery that is also used to reduce the eye pressure in glaucoma. And so that is actually a surgery on the iris where part of the iris may be removed. Okay, so that's what we have. I just wanted to make sure I clarify those terms. So let's take a look at the next picture. Actually, let's go back for a second. So I want you to think about the kinds of patients that are at risk for glaucoma, and those are patients that have high eye pressure. So you would think patients that have hypertension. Also, patients that have diabetes are at greater risk for glaucoma. So that goes along with your patient teaching. Make sure the patient attends their annual eye exam, and if they're at high risk, they may be required to attend an eye exam every 6 months instead of every year. So we'll talk about beta blockers for glaucoma. So this picture shows beta blockers that are used for glaucoma. And so it's actually pretty humorous the way that they have everything set up. So let's briefly talk about the different kinds of medications that can be used for glaucoma. So we have the beta adrenergic blockers, and so these are non-selective beta blockers. They have both beta and beta 2 properties. So examples of these medications may be timolol, cartelolol, metipranolol, levodobunolol. Okay, so these are beta adrenergic blockers. So the purpose of these medications is to decrease intraocular pressure by decreasing the amount of aqueous humor produced. So the therapeutic uses are for topical beta blockers. They're used primarily to treat primary open angle glaucoma, and they can be prescribed in a combination with other topical medications to lower the intraocular pressure. These medications are occasionally used to treat acute closed-angle glaucoma on an emergency basis. There may be some complications with your beta adrenergic blockers. So there may be stinging discomfort. And so this is probably a transient effect. So let your patient know before they start using this medication that they may have some stinging discomfort. Also, they may experience occasional conjunctivitis, blurred vision, photophobia, and dry eyes. These particular conditions need to be reported to their healthcare provider. They probably will have to go in to be seen. So what you want to educate your patient on are some of the systemic side effects of beta blockers on the heart and the lungs. So these beta blockers may cause heart block, bradycardia, bronchospasms, and hypotension. So what we want to let the patients know, they have to avoid excessive dosing so they will prevent systemic effects. When taking beta blockers, monitor for bradycardia, and they should notify their healthcare provider if the heart rate is less than 58 beats per minute. So other medications that are important to understand when we're talking about glaucoma are alpha-2 adrenergic agonists. And so these medications are supposed to decrease the production and outflow of aqueous humor to help lower the intraocular pressure. So another line of medications or class of medications are the prostaglandin analogs. And so these medications serve to reduce the intraocular pressure by increasing aqueous humor outflow through the relaxation of the ciliary muscle. Osmotic agents are another class of medication that can be used for your patients with glaucoma. And so the therapeutic use for this, or the expected pharmacological action, is that they will decrease the intraocular pressure by making the plasma hypertonic, thus drawing fluid from the anterior chamber of the eye. And so the osmotic agents are very useful because they treat the rapid progression of closed-angle glaucoma to prevent blindness. Let's talk about cataracts. So we talked about cataracts, and cataracts are slow, progressive clouding of the lens. And so manifestations of cataracts are painless diplopia, and they may have blurred vision. And diplopia is going to be double vision. So there's decreased visual acuity, frequent change in eyeglasses prescription, and the patient may perceive surroundings being dimmer. So the nursing intervention, and so in a preoperative state, we want to dilate their eyes. And then we will administer the medications as prescribed. The patient may have mydriatics, antibiotics, or corticosteroids prescribed. So for post-operative for this patient, and usually it's cataracts that will be removed surgically. So post-operative, we will keep the operative eye covered. We will elevate the head of the bed 30 to 45 degrees and do not turn the client onto the operative side. because that will create too much pressure on their eye, so you don't turn them on the operative side. Instruct the client to avoid bending at the waist, lifting, sneezing, and coughing, and do not touch the eye area. Prevent vomiting or straining and report severe pain immediately. So the therapeutic measures we'll take for your patients with cataracts, surgical treatment will, of course, removal of the lens, usually under local anesthesia, and they will more than likely have an intraocular lens implant. Okay, many times folks that have patients that have the cataract surgery that may have worn glasses before, they say that they don't have to wear glasses initially. So it's really an amazing surgery, and it's an amazing procedure that the patient goes through. So let's talk a little bit about corneal transplants. So this picture talks about corneal transplants. And so a patient that may need a corneal transplant, they may have several eye problems. So they could have a corneal scarring because of an injury or because of infection. They may have corneal ulcers or sores. They may have a medical condition that makes a cornea bulge out. They may have thinning, clouding, or swelling of the cornea, or they may have a genetic or an inherited eye disease, or they may have some side effects of an earlier eye operation. So there's different kinds of corneal transplants. So there could be a full thickness corneal transplant where all the layers of the cornea are replaced. There is a partial thickness corneal transplant, and so they will actually just go in to replace the deep anterior portions of the cornea. And then there's the endothelial transplant, and so this is the innermost layer, the endothelia, that is actually removed in this particular case. Okay. So we are going to talk about macular degeneration. Okay, and so we have here ARMD, and let me just flip to my notes. All right, so when we're talking about macular degeneration, it's an often age-related macular degeneration, and it's a central loss of vision that affects the macula of the eye. There is no cure for macular degeneration, and so it is a common cause of vision loss in older adults. So as you can see by this pictorial, there's two types. There's dry and wet. So dry macular degeneration is the most common, and it is caused by a gradual blockage in retinal capillary arteries, which results in the macula becoming ischemic and necrotic due to the lack of retinal cells. Wet macular degeneration is less common in its form and is caused by new growth of blood vessels that have thin walls that leak blood and fluid. So when we are assessing our patient for macular degeneration, we're looking at the risk factors, which consist of smoking, hypertension, being female, short in body stature, family history, a diet lacking carotene and vitamin E. And keeping in mind that wet macular degeneration can occur at any age. The expected findings in a patient with macular degeneration is a lack of depth perception, objects appear distorted, blurred vision, loss of central vision, and blindness. So for this, the diagnostic procedures will consist of an ophthalmoscopy, and so an ophthalmoscope is used to examine the back part of the eye, looking at the fundus, including the retina, the optic disc, the macula, and the blood vessels. We can also expect that the patient will have to have a visual acuity test using the Snellen chart and the Rosenbaum eye charts. So for wet macular degeneration, there may be laser therapy used to seal the leaking blood vessels, and then ocular injections to inhibit blood vessel growth. And so that's what the gentleman at the bottom is saying, yes, once a month I'll get these treatments. So they may have to have injections in their eyes. So you want to educate your client to consume foods high in antioxidants, carotene, vitamins E and B12. The provider may prescribe daily supplements high in carotene and vitamin E. As loss of vision progresses, clients will be challenged with the ability to eat, drive, write, and read, as well as other activities of daily living. Refer clients to community organizations that can assist with transportation, reading devices, and large print books. Now let's talk about the eye medications. So this pictorial is showing you myotic, so it's little word, so little pupil. So it will actually cause the pupils to constrict. And then mydriatic is big word, big pupil, is going to cause the pupils to actually dilate, okay? So a key note is do not administer eye medications after hand hygiene solution. That hand sanitizer will irritate the patient's eyes, and hopefully you are going to be using gloves, but that's also a teaching for them at home. Okay, so they're better off washing their hands with soap and water prior to administering their own eye drops. Okay, here's another pictorial that's talking about glaucoma. Okay, and so glaucoma, there's two types as we mentioned before. And so there's the primary open angle glaucoma, and then there's the angle closure narrow angle glaucoma. So open angle glaucoma is the most common form. Peripheral vision is lost gradually with the central visual field occurring if less damage to the optic nerve continues. So they will continue to lose field vision in the central field if the optic nerve damage continues. Clients typically do not experience manifestations until there is widespread damage. So that's why the first picture showed that it was silent and it just happens over time. So the expected reference range for IOP is 10 to 21 millimeters of mercury. But if the IOP is greater than 21 millimeters of mercury, there's a major risk factor for primary open angle glaucoma. So glaucoma can also occur at therapeutic IOP levels. So that's something that has to be monitored. Okay, so primary open angle glaucoma is treated by beta adrenergic blockers, alpha 2 adrenergic agonists, prostaglandin analogs, cholinergic agonists, and carbonic anhydrase inhibitors. Okay. Okay, this is otitis media, and so by the appearance of our pediatric patient, you see that it's something that occurs in your pediatric patient many of the times, and so looking at it, you'll see the signs and symptoms that could be expected to find. So let's see, let's talk about this, otitis media. Okay, so otitis, you're thinking an inflammation of the ear. But before we talk about that, let's talk about an auditory assessment. So the auditory assessment will consist of inspection of the internal ear, examination with an otoscope, evaluation of the gross anatomy of the ear. Okay, they may have a hearing test or audiometry that takes place. So the other thing that we're looking for in the ear, we're looking at the tympanic membrane, and we're looking to make sure that the patient has the light reflex. The light reflex should be apparent. If not, that's an abnormal finding, and we'll have some concerns about that, that tympanic membrane. Okay, so risk factors for ear issues will be middle ear disorders such as recurrent colds and otitis media, enlarged adenoids, trauma, changes in air pressure like scuba diving and flying. Also, another risk factor is inner ear disorders, viral or bacterial infection, damage due to ototoxic medications. So for our middle ear disorders, there may be hearing loss, a feeling of fullness and pain in the ear, red inflamed ear canal and tympanic membrane, a bulging tympanic membrane, fluid or bubbles behind the tympanic membrane, diffuse appearance or inability to visualize normal light reflex. They may also have a fever. Another expected finding when we're talking about inner ear disorders is hearing loss, tinnitus, dizziness or vertigo, vomiting, nystagmus, and alterations in balance. So for our patient that has any ear disorders, we're thinking audiometry, tympanogram, where we are actually measuring the mobility of the tympanic membrane, the Weber and the Rhine tests. Remember, those are the tests with the tuning fork that we tap. We place the base at the middle of the forehead or on the actual mastoid bone behind the ear. Okay, let's see what else. So this, I really love this picture because it gives you a great idea of what to expect in your patient with otitis media. And discharge from the ear is going to be a red flag. And so this patient must be treated with antibiotics taken for the full course, okay? And if they have recurrent otitis media, recurrent ear infections, they may have to have surgery to place ear tubes to drain the ears. Okay, so refractive errors is going to be the last thing that we discuss. And so when you think myopia, you think nearsighted. Think they can see near. Hyperopia, think farsightedness. Okay, farsightedness, it's high and far. So maybe that will also help you. And also presbyopia is also included here as well. Okay, so myopia is nearsightedness, distant objects appear blurred. Hyperopia is farsightedness, close objects appear blurred. Presbyopia is farsightedness associated with aging. So that is your patient that may not have worn glasses their whole life until they get into their mid-40s. They now are requiring glasses for reading. So this is a progressive condition in which the lens of the eye loses its ability to focus. So those are our refractive errors. Thank you very much for your time and your attention. Please make sure you're reading your chapters and reviewing all of these topics in your ATI book. And always think like a nurse. Until next time.